smoking out of the kitchen. I don't know if that's a good idea. Anyway, thanks for being here. I'm Joe Esposito. And what we're going to talk about, sneaking around on me.
Sorry.
Okay.
Thank you so much.
So, I'm Joe Esposito, and some of you know my voice. That's what I look like. Sorry. So, I'm going to talk today about what happens in digestion. When it comes to health, you have to have three things: a normally functioning nervous system, a normally functioning digestive system, and good nutrition. And I think the digestive system is the one that everybody ignores. Well, most people ignore all of them, actually. So, we got to have a normally functioning nervous system, normally functioning digestive system, and good nutrition. Because it's not just what you ingest, it's what you digest. And this is important. You got to get this, because you can have a good diet and still be sick because you're not absorbing the nutrients. And you're not passing out your waste products. So we have to talk about how the body works, what is digestion, and then what you can do to make it better. Because I always joke that 85% of my patients have digestive problems, and 15% lie. 100%. Because everybody's got something: gas, bloating, diarrhea, acid reflux, heartburn. And when I test my patients, my team of doctors and I, we test our patients, we're amazed how many people have digestive problems that they just kind of blew it off. Well, it's no big deal. My stomach bloats out. I have a lot of burping. I have hiccups. These are all signs that the digestive system isn't working the way it's supposed to. Okay? So, when you eat something, anything, in fact, let's go back a little bit. When does digestion start? When do you think digestion starts? Chewing? Put in your mouth? Okay. I'll give you a little experiment. Okay, everybody, think of a big lemon about this big. Biggest lemon you can possibly imagine. Got it? And you touch it, it's a little soft. Okay? Now I want you to slice it open in your mind. Got it? Just slice a wedge. It's really, really, really tart. I want you to put it in your mouth. What just happened? Salivated, right? So thinking about food is when digestion starts. And so I want you to think about that. So if you start thinking about bad foods, your body already is being bombarded. So once you start thinking, when I put something in my mouth, is this going to be good for me or is it going to be bad for me? It's just that simple. Is this going to help me or is it going to hurt me? And that's a real simple way to pick out what's something good to eat. And you've got a good general understanding of what's good and what's not. Okay? So, it goes into your mouth, you chew your food. That's mechanical. Your teeth are breaking the food down. The reason is when there's cell walls in your food, and you have to burst those cell walls to release the nutrients. Vegetables have a cell wall called cellulose. You need an enzyme called cellulase to break down the cellulose. We as humans don't produce cellulase. Now we have a problem. Everybody tells you to eat more vegetables, right? What if you can't absorb them? Wasting your time. So chewing is one way we can physically burst open those cell walls. Heating your vegetables. When you heat them, the water heats up and expands and the cells burst open. That's another way to release the nutrients. Juicing your vegetables. When you put them through the juicer, we mechanically burst open the cells and release the juice. So there's several ways we can get the nutrients out of the vegetables. If you just swallow your vegetables whole, they're going to pass right through you. You're not going to get the nutrients that you need. So chewing your food is very important. And when you start chewing, it mixes it with saliva. Saliva has a chemical in it called salivary amylase. Big word. Salivary amylase breaks down carbohydrates into simple sugars. So here's a little trick. Whenever you bake something, you ever notice you add a little bit of salt? You ever wonder why you add salt to baking? Salt causes you to salivate. So now you release more saliva, which breaks down the sugars, but it tastes better. You might know it tastes better, now you know why it tastes better. Okay? So that's why we add a little bit of salt to our food to release it. Now if you're going to use salt, there's good salt and there's bad salt. I had a patient in yesterday and she said, I got to cut back on my salt. And I said, no, you got to increase your salt. What? Good salt, bad salt. Good salt, air-dried sea salt. Himalayan salt, Celtic salt. These are good salts. Bad salt, white table salt. So you don't want to be using white table salt because that's bad for you. The other salt has about 70 different nutrients in it. So it's actually good for you to use air-dried sea salt. And I would recommend everybody use it on purpose. Because it's going to give you minerals that you're not going to get other places, or you're not going to get in good quantities other places. Now some people think that salt has iodine in it. Salt, white salt, we add iodine to it. It's not a good source of iodine. There's good and there's bad iodine. This is not a good source of iodine. And it'll prevent you from getting a goiter, which means your thyroid doesn't swell up, because your thyroid needs iodine, but it's not the best kind. Air-dried sea salt doesn't have iodine in it, or very little. So don't think you're going to start using air-dried sea salt and get iodine. You need to get iodine from other sources. The reason is every cell in your body has an iodine receptor site, which means every cell in your body needs iodine. We don't know why. We know the thyroid does because the thyroid uses iodine to convert it to thyroid hormones. And if you ever get the terms for thyroid hormone, T1, T2, T3, and T4, and those are the thyroid hormones your thyroid gland produces. The numbers, T1, 2, 3, and 4, the numbers mean how many molecules of iodine are attached to that hormone. So if you don't have enough iodine in your diet, you can't produce the right amount of thyroid hormones. Thyroid hormones control metabolism, energy, other hormone levels. So iodine is real important. So one thing I want you to consider adding to your dietary intake is sea vegetables. Sea vegetables are by far the best source of iodine. The stuff we put in white table salt, not a good idea. Sea vegetables, great. I'll talk about my supplements in a little bit, but I add sea vegetables to both the super greens and the essential source because nobody eats enough sea vegetables. It's not our culture. Japan, yeah. Here, no. And that's why iodine, exposure to radiation in Japan, I hate to say this, is not as dangerous, it's still very dangerous, as it is here in the States because they protect their thyroid with iodine because of their diets. Okay? That's a whole other story. We're off on a tangent there. So, we have to make sure that our body is chewing the food to mix it with the saliva. It goes down into your stomach. You have it goes down your esophagus, and it goes through a hole in your diaphragm. Right here is your sheet of muscle called the diaphragm. In your diaphragm, you have a hole called the lower esophageal sphincter, and it opens and lets food drop into the stomach, and then it closes. Then your stomach mixes the food with pepsin and pepsinogen, don't worry about the chemistry, and that breaks proteins into amino acids. When the proteins break down into amino acids, they then pass into your small intestine, where they're absorbed and waste products are passed out. Nutrients are absorbed and passed out. With me so far? It's a little complicated here, okay? So, the stomach's job is to take proteins and break it into amino acids. If you're old, me, what happens is your stomach acid starts to drop. You don't have as much hydrochloric acid, pepsin, and pepsinogen to break down the proteins into amino acids. So now our digestion slows down. And the reason we need amino acids is for everything. Every piece of tissue in your body is made up of amino acids. And this is the key I want you to get here on digestion. Those amino acids become neurotransmitters in your brain. Your brain works on neurotransmitters, makes the brain work. Okay, serotonin, dopamine, norepinephrine, and GABA, those are the big four. Tryptophan combines with vitamin B6, creates serotonin. Serotonin in your brain helps you calm down and focus. Why am I giving you all this chemistry? Every case I've ever seen in my 30 years of practice that has an emotional component has an undiagnosed digestive problem. The serotonin is the neurotransmitter that helps you calm down and focus. ADD, ADHD, anxiety, depression, bipolar, suicidal. I've always found patients that have an undiagnosed digestive problem. Got a phone call this morning from a friend of mine. I used to go to school with her up in New Jersey when I was in high school. She said her daughter is in a very serious situation. She's decided she's agender, which means she doesn't have a sex now. That's a new thing, agender. And she's been cutting herself. Okay? And that's a new thing that kids do, by the way. I don't know if you know about the cutting. The kids cut themselves, and they supposedly makes them feel good. I don't understand it. But I said, let me ask you about your daughter. Does she have any digestive problems? She goes, yeah, she burps and hiccups all the time, constantly. She's a digestive problem. And I explained to her what I just explained to you, and she said, wow. She said 3 words I love to hear. That makes sense. I said, we got to fix her digestive system so she can produce the neurotransmitters. Met last week with a psychologist here in this area. And we have offices here in Duluth, and she has offices in Marietta and Duluth, conveniently enough. And so we sat and chatted, and I kind of got into this conversation with her. And she got teary-eyed. And I said, you okay? She said, no one's ever explained that to me. I always treated the patient, let's talk about it, let's work through it, let's do play therapy. No one ever explained the physiology of why the brain doesn't work properly. And that's one of the reasons why the brain doesn't work properly. She got so excited for the first time in her career, something made sense. So it's really kind of cool. So digestion is so key to brain function. Tyrosine becomes dopamine. Dopamine is the neurotransmitter that gives you pleasure. We're all pleasure hounds. We all do things in this, we're always seeking pleasure. We've all done stupid things in the name of pleasure. And many times you're not reaching pleasure because you don't have the proper digestive system to produce the dopamine. GABA suppresses other neurotransmitters. I'm board certified in chiropractic, orthopedics, pain management, double board certified in nutrition, BS in nutrition, retired dietitian, award-winning author. And so I deal a lot with pain management. People come to me all the time. I get tons of emails every day on pain management. And one of the things I have to talk about with the patient is not only chiropractic care aligned to spine, which is vital, but you also have to have the digestive system producing the GABA to suppress the pain signals. It's nature's drug. It's nature's painkiller. And that's why if you're in a lot of pain, they'll give you gabapentin. It's a drug form of GABA, which is your neurotransmitter. So with digestion, it's going to be key. You have to break the foods down properly. If you don't chew them properly, you can't break them down properly. As you get older, you can't break them down properly. If you're under stress, you can't break them down properly. A lot of stuff against you when it comes to digestion. Your stomach sits below your diaphragm, and what I find in so many of my patients, and I promise you if I tested everybody here, I guess 85% of you would have this, the stomach pushes up against the diaphragm and spasms. The stomach spasms, it can't mix the food with the digestive enzymes, and the food can sit in your stomach for too long and it can rot. And when it rots, many times acid comes up into your throat. It's not so much digestive acid, it's rotten acid, lactic acid. When the food rots in your stomach, it gives off lactic acid. And that could be a lot of the burping that you're experiencing in the acid reflux. So we can suppress the acid, which I'm not against short term. If I'm burping and I've got a lot of acid burning my esophagus, that can cause esophageal cancer, I can take pills. But the pills, called proton pump inhibitors, prevent you from absorbing calcium, magnesium, iron. So if you're on these medications, I want you to always do this. Always read the side effects. No one does, right? That little tiny piece of paper you fold up, like a mouse typed it, right? And you try to read it, nobody reads that, you throw it away. But so many people come into my office and, well, I'm anemic. Do you take proton pump inhibitors? Yes. Okay, we can do one of two things. We can give you iron, or we can try to fix your stomach so that you don't need proton pump inhibitors. I'm not against the drugs. I'm against the unnecessary use of the drugs. Following? So, if the stomach is up against the diaphragm, we need to manually pull the stomach down away from the diaphragm. It's an adjustment. We call it an adjustment chiropractic. We pull the stomach away from the diaphragm and massage it to get it to release. And it's incredible because mine acts up too. I have this problem too. And for years I suffered with a lot of burping, bloating, and my heart would race. I remember being a little kid. I remember I was probably less than 10 years old, laying in bed, and I'd feel my heart going, blah, 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 and then it would stop. And then I'd give it a few more beats, and it would stop again. I'm like, wow. So when my mother took me to the doctor, and he says, you have a heart murmur. I know. Well, I'm here. And he said, most people grow out of it. Well, I didn't grow out of it. All my life. My blood pressure was always a little high, even as a kid. When I finally realized, I remember it was several years ago, that the same nerve that controls the stomach controls the heart, called the vagus nerve, V-A-G-U-S. When the vagus nerve is irritated, it can cause the heart to beat abnormally and faster. Grabbed one of my doctors at the time. I said, do this to my stomach. I wonder if this will work. And he massaged and pulled my stomach down away from the diaphragm. Heart stabilized, blood pressure dropped. So it's so much more than just acid reflux or burping. It's actually affecting your heart rate, your nervous system. So if you're having these symptoms, I want you to realize it's a very serious condition. The drugs can cause problems. The heart rate can be thrown off. It can throw off the whole nervous system. Okay? With me so far? So now your stomach does its job, does what it's supposed to do, and the food passes into your small intestine, which is right over here. There's a problem. Your stomach is very acidic, high acid. If I cut my stomach open and poured it onto a carpet, it would dissolve the carpet. That's how much acid I have in my stomach, and so do you. So if we pass acid into our small intestine, it's going to burn a hole in our small intestine. What do we call that? An ulcer. Right, exactly. So now we've got a problem. So what do? We have to make sure our pancreas is working. Your pancreas' job is to take, they produce three things. Pepsin, they produce protease, amylase, and lipase, which break down fat, carbohydrates, and proteins as soon as it dumps into the small intestine. But it also produces essentially baking soda. Baking soda neutralizes the acid, so you don't get an ulcer. This is why if you put too much strain on your pancreas, When you get pancreatic cancer, it's usually very deadly, as opposed to slightly deadly. I guess I don't know. It's usually deadly. It's the wrong adjective there, isn't it? Adverb. Because your pancreas does so many different things, and you just think, well, it produces insulin to help you with sugar. One of the many things your pancreas does. And what's really cool about the body is this. In our office, we take x-rays a lot on our patients as chiropractors, and sometimes we see the pancreas bigger than it's supposed to be. If your body isn't working, in its infinite wisdom, it makes your organs bigger to try to do a better job. Your heart can be enlarged, your thyroid can be enlarged, your pancreas can be enlarged. So that's when I sit down with patients and I say, listen, you got a real serious issue. You got to get serious about what you're putting in your body. I know, but it's hard. Love my sugar. Love my sugar. I know that. Because when you put sugar in your body, it stimulates the dopamine receptor sites. Remember dopamine? Pleasure neurotransmitter? Sugar stimulates the dopamine neurotransmitters. You get high on it. Who doesn't want to get high? Remember, we're all pleasure seekers. And so sugar is the quickest, easiest, cheapest, most legal thing we can do to get high fast. And that's why it's so hard to give up sugar. If you're like me, and you are, if I have a piece of bread, you know what I want more of? Bread. If I have cupcakes, what do I want more of? Cupcakes. Of course. But as soon as I put it in my mouth, man, those pleasure centers are firing off. I'm going, oh, baby, I like this. I want more of that. And so the only way to deal with the addiction is to not put it in your body. That's it. If anyone's ever known someone who's an alcoholic, can they have alcohol on Sundays?
No.
Tuesdays?
Ever.
Thursdays?
No.
Ever is the key word right there. You can never have alcohol. Because as soon as you put a little bit of alcohol in the body, it kicks in those pleasure centers in the brain, you're off the wagon. And yet for some reason, nobody says that about sugar. It's the same thing. Alcohol's a sugar. That's what it is. And so you're putting it in the body, stimulating the pleasure centers in the brain, you want more and more and more. Think about that. And if you're an addict, step number one in AA is you have to admit you have a problem. So if you can't stop eating sugar, you have a problem. And you have to admit, I have a problem. And then you have to do something about it. And you can't say, well, Tuesday's my cheat day. Alcoholics don't have cheat days. You can't either. Because the sugar throws everything off. Sugar's an acid. And what happens is when you put acid in your body, now your stomach is very acidic. Everything else is slightly alkaline. When you put an acid in your body has to neutralize the acid. The body uses calcium as its primary neutralizing agent. All day, every day, I get emails from ladies saying, I have osteoporosis, what should I do? And I say, take your acid levels. You can get pH papers, you can get them here, you can get them at a drugstore, and I want you to pee on it first thing in the morning. It's a little penny strip of paper about that big. And you pee on it first thing in the morning, it's going to turn a color. Look at the color chart, and you should be about 6.5 to 7.0 with your first morning urine. If you're 6.5 to 7.0, you're in good shape. I've never seen an osteoporosis patient ever who wasn't at 6.5 or lower. They're too acidic. Put acid in the body, steals calcium from the bones to neutralize the acid. So in many cases, it's not that you have too little calcium, it's that you have too much acid. And if that was the case, every woman with osteoporosis would take calcium and the problem would be solved, right? And yet in 30 years of doing this, 0 women or men I've ever known have taken calcium and solved the osteoporosis problem. 0. So obviously it doesn't work. So what we need to do then is realize, why are we having this? When I talk about your health, if you listen to me on the radio, you've been to my lectures before, I want to get to the cause of your problem, not just treat the symptoms. So with digestion, many times the problem is physical, not chemical. Stomach is pushed up against the diaphragm, we need to pull it back down. There's a little valve down here called the ileocecal valve. When it opens, food passes from the small intestine into the large intestine. In the large intestine, water is absorbed and it's passed out. Then the valve closes, then it opens and it closes. If the valve is stuck open, you have diarrhea. If the valve is stuck closed, you have constipation. So we can try to force it through with laxatives, and that's okay. Sometimes we need to jump start it. But I always want to check the ileocecal valve to see if it's opening and closing the way it's supposed to. If it's not, same thing. Outside, external, kind of a massage type technique to get it to start opening and closing. Then we have to look at what controls the stomach, small intestine, large intestine, and the ileocecal valve, the nervous system. Your brain right now is sending a message to your liver, your spleen, your kidneys, your earwax, your toenails, your eyeballs. Everything has a nerve going to it. So if you damage one of those nerves, the messages from the brain can't get to the spleen or the kidneys or the toenails. So that part of the body can't work. So if you have gas, bloating, diarrhea, constipation, I want to check the low back because these are the nerves that go into the colon, sex organs, and bladder. Gas, bloating, diarrhea, constipation, urinary problems, sexual problems. Pinched nerve in the low back goes into the organs, got to fix it. Makes sense, right? Okay? If we came into the cafe today and the lights were off, what was the first thing we would do?
Turn them on.
Turn them on. Right? See how easy that was? And yet for some reason when it comes to your health, we never think about turning on the switches to make the organs work. Pinch a nerve, unpinch it. It's pretty simple. Dr. Sue out of Colorado did research. He found that the weight of a feather placed on a nerve can cause the nerve to malfunction up to 80% of its capabilities. So imagine if you have a swollen disc or a ruptured disc or a pinched nerve or arthritis. Really pinching those nerves, you got a real serious issue. And that's why it's so vital that the things that are missing in healthcare are the three things we're talking about today. Normally functioning nervous system, normally functioning digestive system, good nutrition. It's not hard, it's easy. It's simple. And people look at it and go, well, how can I obtain health? Nervous system, digestive system, nutrition. Try it and see, and if I'm wrong, so what? Not. But if I am. But it's really cool because I got an offer from one of the major universities, one of the medical hospitals here, I won't say their name, it's a big cake, and they asked me if I would come teach endocrinology. And I said, I'm a chiropractor, I'm not an endocrinologist. They said, but you explain things so simply that even the head of the endocrinology department was like, oh, that's how that works. So I know I'll give you a lot of chemistry and anatomy and physiology, but I want you to understand how your body works. It's all we got, guys. This thing's done, we're done. You can buy a new car, buy a new house. Can't get a new one of these. You got to maintain what you got. And we don't have extra parts. So we have to have the nervous system working. You have to check the nerves to the stomach. How about the nerve to the diaphragm? You know, the nerve to the diaphragm comes from here. It's called the fourth cervical nerve, the phrenic nerve. It comes down and controls your diaphragm so you can breathe. So if you have a pinched nerve here, the diaphragm may not be going up and down properly. That's why if you ever see somebody with a fractured neck, if they're above the fourth cervical, they're on a respirator. If they're below the fourth cervical, they're not. So when you break a neck, you can't breathe. Why? This is the nerve that controls the diaphragm. So you may be in a car accident, pinch the nerve to your diaphragm, the diaphragm spasms, doesn't go up and down, it irritates the stomach, you start having acid reflux, you start taking proton pump inhibitors, which prevent you from absorbing iron, and you get iron problems. Off of a car accident you've been 20 years ago. So everything ties together. Nothing happens by itself. And that's what you have to understand. There's 206 bones in the body. Any one of them can come out of place, which will affect the other 205. And the nervous system. Trillions of nerves. We don't even know how many nerves there are. We can't count them. Want to so far? So digestion is key. You have to look at the physical components. So if you have digestive problems, understand, maybe the stomach up against the diaphragm, maybe a pinched nerve going to the organs. I have a lot of people come in and have chronic cough. Acid coming up into the throat. Pull the stomach back down. I don't cough anymore. It's amazing. I've had patients come in, they go back to a gastroenterologist, he takes a scope and says, there's no more redness. What did you do? Well, Dr. Joe and his team of doctors did my stomach. Oh, I know him. Good, keep doing that. They don't refer me patients directly. But it's kind of neat. So when you pull a stomach down, that's vital. So much of digestion is physical, not chemical. Okay? That's 20 minutes, you know more about digestion than most doctors. How about that? Let's talk about food, what happens in digestion. As the stomach acid starts to drop, we need to increase the stomach acid. Now we can do several things. Number one is we can take digestive enzymes, which sometimes is necessary, and I put digestive enzymes in the essential source. It's going to help your digestive system. But I like to stimulate your own digestive enzymes. Once again, I like to get to the cause, not the symptoms. As we get older, we will have less digestive enzymes. Let's add some digestive enzymes to our diet, but if we do something like raw organic apple cider vinegar, she's smiling. This stuff is awful. How do you drink this? With orange juice. You don't say I don't like it. I'm a sissy. So, it's horrible when you drink it, yeah, okay. First throat, yeah. You what? Chug it fast, yeah. Shots, right? Like in college, there's 2 shots of it. You're getting old, right? You have 2 shots of this instead of vodka, right? But raw organic apple cider vinegar can actually stimulate your digestive enzymes, which is kind of good. So I don't like eating it. What I do is I use it on my salad every day. when I make a salad, I just make this part of my salad dressing, and that's a good way to get this into your body. You can buy it in capsule form. It's very expensive. It's okay. That's only $4 or $5 for a bottle of that stuff. So, yes, sir.
Is it okay to put it with your...
Absolutely. You can mix it with super greens and essential source. Back when I was 29 years old, there was a song by Oleta Adams. It says, "I don't care how you get here, just get here." That's how I feel about apple cider vinegar. I don't care how you get it, just get it. Yes.
Does it matter how many times a day you drink?
You can do it up to 3 times. You can do it as many times as you want, but about 3 times a day. Some people, when they're really severely depleted, I'll have them taking it with every meal. And then once I kind of jump start the pump, then we can start pulling back a little bit.
And what's a good amount?
About 2 tablespoons. Okay?
How much water?
As much as you can.
Can you drink it with a little bit of water?
You can drink it with a little, a lot. You can drink it straight. You can mix it in a salad. Now here's a fun story. My grandparents came over from Germany, 1923. They came over on a ship called the Bremen, and they were getting away from Hitler. Okay, so the families at the time, they had the children, they were 13, 14 years old, didn't speak English, put them on a boat. How many days later, they finally got to America, they didn't speak the language, they get off a boat, they're looking at New York City going, now what? I mean, talk about gutsy, right? We don't want to drive 20 minutes. In a boat with a little sack and no money, so. But one of the things my grandmother and my grandfather used to do is, as Germans, they would eat a lot of beans. Lentils, beans, split pea soup. And she would always add apple cider vinegar to it. And I asked my grandmother as a kid, this is way before I ever realized what I was asking her. I said, "Why do you put apple cider vinegar in it?" She goes, "All right." Because my mother did, you know. Looking back now, we understand why. Apple cider vinegar stimulates the digestive enzymes, break the proteins and the sugars down, so you have less gas and it's easier to absorb. Better absorption. So they knew how, they didn't know why. Now we know why. So that stuff is pretty cool. Okay? And that'll help stimulate the digestive enzymes. You also have to eat more raw food. When I say raw, I'm not talking about raw steak. You need to eat more raw fruits and vegetables, nuts and seeds. Because the raw foods have enzymes in them. And the enzymes are going to help digest themselves. So if I cook a carrot, I've destroyed most of the enzymes. Is the carrot still good for me cooked? Yes, it is. Is that as good as it could be if it was raw? Well, as long as I got to chew it, because I got to chew it and burst open the cells. Remember cellulose? We started the seminar with cellulose. So I have to chew the carrot really well, or juice it, or blend it. But if I cook the carrot, it's going to burst open and release the nutrients, but it's going to destroy the enzymes. Anything above 110 degrees, the enzymes are destroyed. So I want you to have something raw at every meal. I don't care what it is. You know, could be lettuce, cucumbers, tomatoes, avocados. I eat avocado just about every day. And the raw food is going to give you enzymes to help digest the food. So when you eat food, you don't really digest it. You chew it up, goes into your stomach, stomach releases acid, breaks proteins into amino acids, dumps into your small intestine, protease, lipase, and amylase, lipase, and protease are released in the pancreas, and they start interacting with the food. And then you have bacteria in your colon. And you have over 100 different types of bacteria in your colon. And that bacteria breaks down the food, absorbs what it likes, spits out what it doesn't like, and you absorb what the bacteria doesn't. This is why it's so vital you have to take care of the bacteria in your colon. There's new work being done now, a couple of clinics around town are doing it, we're not, on people that are fat. Now I can say the F word because I used to fill out this skin. Okay, I used to be extremely overweight when I was a kid. So they're taking, skinny people have different bacteria in their colon than fat people. And they're doing fecal transplants, no kidding. Fecal transplants, taking the bacteria out of somebody who's skinny and putting it in somebody who's overweight to change the bacteria so they digest their food better. And it seems to be working in many cases. You've heard about this, nod your head. Pretty cool stuff, huh? Now, I think it's a little extreme. Throwing it out there as a personal opinion. I think if you eat less, I mean, the best way to lose weight is eat good food. Okay? I had lunch today with a friend of mine, and he runs a gym, and he's looking for ways to get more business. He goes, "What's the best way to lose weight?" I said, "Stop eating." And he said, no, what about the lasers, and what about, far infrared saunas and everything? Those are all great. But you also have to do the diet modification. And you do it by eating good foods. If you want to diet, you have to eat good foods. It's very simple. So the bacteria in your colon are vital, and they control Your brain. Remember I said anxiety, depression, bipolar patients always have an undiagnosed digestive problem? So 95% of the serotonin, the neurotransmitter that keeps you focused, is utilized in your digestive system. 5% is utilized in the brain. So if you're not making enough serotonin, and this guy wants 95% and this guy wants 5%, guess who wins? This guy. Because you have to break the food down to feed the body. So this is primary, this is secondary. So that's why you have to make sure you're eating good foods. You have to respect the bacteria in your colon. You take antibiotics. Antibiotics kill off good bacteria and bad bacteria. I am not against antibiotics. I'm against unnecessary use of antibiotics. American Pediatric Association recently, well, not a while ago now, said you shouldn't be giving antibiotics for ear infections. Because children heal just as fast with the antibiotics or without the antibiotics. Now, there are cases that aren't going to fit that model, of course, but they're telling the doctors cut back on the use of antibiotics because it's killing off the good bacteria. The good bacteria help digest your food and help your brain work. So when I was a kid, everything was antibiotics. Didn't matter what you had. Had a hair lip, take an antibiotic. Everything was antibiotics, right? And so antibiotics were given to everybody because it was the miracle drug. Well, now it turns out there's side effects. It always turns out there's side effects. That's the problem. I'm not against drugs, but understand there are long-term side effects. If I have a headache, take an aspirin. But then I have to ask myself a question, why do I have a headache? So what do I got to do to fix the headache? Usually a pinched nerve in my neck. Football, hockey, street fights, I was a crazy young kid, and I did a lot of damage to my neck. So if that bone moves out of place, we go to a chiropractor, we get it adjusted, we open up the nerve supply, we fix the digestive system so I can break down my proteins. And also, if you're not breaking down your food properly, it gets into the small intestine and it causes an inflammatory reaction. That inflammatory reaction becomes systemic, which means it comes through your whole body. Your whole body can become inflamed. So when patients come into me for pain management, I have to say to them, we have to change your diet because we have to bring down the inflammation so that the pain goes away. We can't just treat the inflammation, we have to treat the whole body as to why you have the inflammation. With me? So we have to make sure we bring the inflammation down, and if you're not digesting food properly, it's going to cause inflammation, undigested food in your small intestine. So digestion is so closely linked to brain function, organ function. Every cell in the body needs nutrition. Acid reflux, heartburn, the acid can get out of the stomach because you don't have anything to alkalize the acid as it comes up. You have something from the pancreas that alkalizes as it goes down, but not when it goes up. So it's not hard to do. It's actually pretty easy when you start understanding how the body works. So what can we do about getting the good bacteria in our colon? Number one is you have to feed it. It's a living organisms, millions of them. How can we feed it? You can take something called probiotics. Everybody heard that word? Probiotics are good bacteria. You can take the good bacteria, and I put probiotics in the essential source. So you can take that, and that's great, but the bacteria that are already in your colon need to be fed. And they get fed on something called prebiotics. Prebiotics are the food to feed the probiotics. Where do we get that from? Undigestible fiber. From the oligosaccharides. Fancy word, I like saying it. But there are certain types of sugars and fibers that the bacteria will break down. Remember I said the bacteria digest things and then spit it out and you get the rest? You get the leftovers? Well, if you're feeding the bacteria prebiotics, they're able to be healthy, multiply, and produce more prebiotics, make little prebiotic babies or probiotic babies. So I add prebiotics and probiotics to my essential source. This is why I think everybody should be taking super greens, which alkalizes the system. Remember we talked about too much acid? And an essential source, which is vitamins, minerals, and nutrients, complete multivitamin, dried fruits and vegetables, and this is cool. We juice the vegetables and take the water out at about 70 or 80 degrees. We just take a fan and blow it over it. Like if you had a wet carpet, we put a fan on it. When you blow the air over the vegetable juices, we burst the cells open, broke open the cellulose, take the water out, what's left is a powder. And that's what's in the super greens and the essential source. How cool is that? So I made it so easy for you. You don't have to chew it. You don't have to cook it. Take a scoop of each. I took it before I came here today. My second time I took it today. I took it this morning and I took it now. Because whenever I do an event, if I'm going on a date, if I'm going hiking, if I'm going to do a lecture, if I'm going to do radio shows, I'll take a second dose of super greens and essential source to make sure I've got all those nutrients in my brain working as quickly as it can. People say all the time on the radio, they say, oh, you know the questions, right? You listen to me on the radio? I don't know the questions. You call up, it'll say, Barbara from Marietta wants to know about toenail fungus. You know? And I'll say, hey, Barbara. And she'll come on, and she'll start talking. I don't know what she's going to say. No one's prepped about these things. And so my brain has to be working, because we're live. We're in 36 states. So it's a nationally syndicated show. This station goes to 36 states. There's about 20 or 30 other stations that carry the show as well. So we're internationally syndicated. I got to be able to answer questions quick. How do you do that? Keep the brain working. How do you do that? Give it the proper nutrition to produce the neurotransmitters. So it's not hard, it's easy. And I'm no smarter than you. I just have my brain working. And you can do that too. So I think everybody should take the Super Greens, the essential source, every single day. I couldn't imagine going a day without it. It really is that good. It's relatively inexpensive too, which is kind of nice. So these things are cool. Now, we said food should go, yes?
Why is it a powder? I don't like powders, though.
Okay, what would you like me to do to it?
Or something.
If you put it in a pill, you'd have to take a ton of pills. My original plan was put fruits and vegetables in a pill. And I spoke to my food chemists, and they said, you know, if you take a scoop of each, that's a lot of content. And so if you put it in pills, you'd have to take handfuls and handfuls of pills. And when you press the pills, heat can destroy some of the nutrients and the enzymes to make it a pill. So you can put it in capsules, then the price skyrockets. So I said, how can I make it the least expensive with the most efficient delivery system? And that's why it's powder. Now what you can do is make it in a smoothie. Take a frozen banana. Okay? All right, well, that's an option. Okay? Yes, I think it's delicious. I love it, man. I know. I look forward to it, actually. Yeah, it's so good. So the Super Greens, the essential source, are great. Now, we said the bowel should move. The bowel should move 2 to 3 times a day. Not a week. Not a month. A day. Food in should mean food out. Babies do it. They're good at it. We're not as smart as babies, apparently. So babies can figure it out. We can't figure it out. Right? Baby eats it. Like, how did this come out of that? You know, they're only this big and there's 10 diapers. So, but food in should mean food out. And most of us don't do that. Why? We're busy, our digestive system isn't working properly, we don't want to use a public toilet, I got a meeting, I can't go right now, I got a lot of stress. So I created something called Dr. Joe's Intestinal Cleanser. Now this is only for short-term use. This will jumpstart your bowels if your bowels aren't moving. You adjust the nerve supply in the low back, you fix the ileocecal valves, you fix the stomach, you get somebody with a good diet. Sometimes the bowels just need a jump start, and this stuff is great for that. Okay, my goal is to get you on this and then off it. Super Greens is an essential source forever. This, short term, okay? I want to make sure you don't take that stuff forever because I want to, well, if you can take it forever if you don't fix the cause. I'd rather you fix the cause. Okay. So if we get food in and food out, we can absorb the nutrients, pass out the waste products, and get the proper nutrition, break the vegetables down, break down the cellulose, absorb the nutrients. That's why Super Greens is the essential source. And you understand only put good food in your body, then we're in good shape. So there's 120,000 good foods you can eat. There's 7 you should avoid. Just that simple. The 7, you know what they are, right? Alcohol, meat, sugar, dairy, coffee, soda, and artificial sweeteners. My God, that's everything. I just named your whole diet. But this is cool. I've been doing nutritional evaluations for over 30 years. I have patients write down what they're eating. And then I'll sit down with them and I'll say, okay, here's some advice for you. You're doing a beef burrito every day. Can we do a bean burrito? Well, I can do that. Okay, because beef has no fiber in it. And I said, okay, let's do a bean burrito. Now, next step, let's not do the wrap, let's do a bowl. Oh, I can do that. Okay. All right. I know you're doing pastas, and I know you love your pastas. Can we switch from a wheat pasta to a quinoa pasta? Okay, I can do that. Because wheat has something in it called gluten. Gluten contains gliadin and gluten, and they cause inflammation of the bowels. And we don't want inflammation of the bowels, right? Talked about inflammation and pain. So if we can get you off the gluten, then everyone here should give up all wheat. An hour ago. You should give up all your wheat, and you'll be amazed how much better you feel. The bloating goes away, the love handles start to fall off, brain works better. Give up your wheat, barley, and rye. Start switching to gluten-free breads, cookies, cakes, donuts, and pastas. Now the good news about this is they don't taste good. So you won't eat them. Mary made me gluten-free carrot cupcakes yesterday. And they were spectacular. Okay? Why? Because they weren't overwhelmingly sweet. So I ate 2. I shouldn't have. But when I ate it, I didn't have to go through the rest of the day going, man, I'd go for another one of those. Oh my God, because the pleasure centers in my brain weren't stimulated. My taste buds were happy. I was happy. but I didn't get that pleasure dopamine receptor site stimulation going on. So you can enjoy something, not to that extreme. And it was fun. Okay. So give up those bad foods. And what I do is I'll look at somebody's diet, and most people, and if I made you do this, I'd see it too, you're going to eat the same foods over and over again. If you looked at your diet for the past year, I'm going to guess 6 or 7 foods you pretty much eat a lot of. It might be chicken, it might be burritos, it might be French fries, I don't know what it is. So if I can take those 6 or 7 things and replace them with 6 or 7 other things, nothing changed. You're still eating 6 or 7 foods over and over again, but I made better choices for you. And that's what I do with my patients when I sit down and discuss their diet with them. If you're going to do this, let's do this instead. Okay, I'm willing to negotiate on everything. Because I realize that not everybody's going to give up their alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener. I'm a realist. I'm a vegan. I've been a vegan for over 30 years. I know one other vegan that I would consider a friend. Okay, so if I only hung out with vegans, I'd have no friends. And I have a lot of friends. So it's okay. And no one cares what I eat, as long as I don't care what they eat. That's perfectly fine. I went out to lunch today with 2 friends of mine. One guy had, it was Korean food, he had an egg with his. I had all vegan, the other guy had chicken soup. We didn't talk about food. It wasn't the topic of conversation, so it doesn't have to be it doesn't have to be a big deal. Very simple. I'm going to eat order something healthy. And the cool part is that it's always the cheapest thing on the menu. So it's wonderful. I always joke about it. I say, cover up the food, look at the prices. Pick the cheapest thing, go backwards, and it's going to be the healthiest thing on the menu. Always. So you'll save money, you'll feel better, you'll live longer. If you gave up just dairy products, which are real hard to digest, 8 years, 8 quality years added to your life on average. If you gave up all animal products, 11 quality years. To me, that's worth it. I mean, yeah, do I miss meatball sandwiches? Yeah, I do. Wheat, meat, cheese, dairy, so I wouldn't do it. Do I miss it? Yeah, I do, but that doesn't mean I'm going to have it.
So you would never just try or go for it one day?
December 25th, 1986. I had spare ribs. They were so good. I've had no animal products since then. And the reason is I drove back to Georgia. I was so poor, I had no money to buy food. I was visiting my parents up in New Jersey. I drove back. I had no money to buy food, really. So I started going to the grocery store. They were right across the street. It was called Metro Grocery. They're not there anymore. But on Tuesdays, they would have the dented cans, the rotten vegetables, all the cheap stuff. And I would load up on that stuff. And I started eating like that, only because I was poor. And I understood. I started knowing nutrition about 35 years ago now. And I started feeling really good. And I went, wait a minute, I'm saving money, I'm feeling good. There's something wrong here. So then I said, okay, is this what it is? And the answer was yes. That's what it was. I was just eating better. My sinuses stopped running. I started to lose weight. My brain worked better. I slept better. Breath freshened. I was like, wow, this is a great thing. So yeah, there's no need to cheat. People always ask my friends, "Does you ever cheat?" But there's no need to. It's so much cheaper and easier and quicker to eat this way than it is that way. But you have to look at not just the digestive system, the diet, and you have to look at the nervous system. Because the nervous system controls everything. This is the missing link to healthcare. I hope we get a new president. They pick me for Surgeon General. And I'll go up to Washington and I'll straighten everybody out. And we'd solve the healthcare crisis. The problem is we're not treating the cause, we're treating the symptoms. If we can incorporate treating the symptoms and the cause, now we have a healthcare plan. You might have an insurance plan, but you don't have a healthcare plan. I've just given you a healthcare plan. Normally functioning nervous system, normally functioning digestive system, and nutrition. So if you have neck pain, back pain, shoulder pain, numbness, tingling, muscle weakness, everybody does. Don't lie to me, I know you do. Okay? Chances are it's a pinched nerve. And if you're pinching a nerve, why don't we just unpinch it? I know it's silly, it's pretty logical, it's real cheap. Why not do it? When you put the bones back in place, any one of the 206 bones in the body can come out of place, put them back in place, massage the stomach away from the diaphragm, get the diet straightened out. It's amazing. And the biggest complaint I get, you've heard me say this before, the biggest complaint I get in my office is, why didn't I do this sooner? Why did I suffer for so many years? Why did I do all these other treatment plans? And people come to me and say, you're my last hope. I said, good. You're done now. Okay? Can we help everybody? No, we can't. Can we help almost everybody? Yeah. And most patients get the best results when they do what we say. It's just that simple. because 90% of your nerves don't feel pain. So you can have a pinched nerve and not know it. And that's why in our office we check the stomach, the cecal valve, we check all the nerves, all 24 vertebrae, to see if they're misaligned vertebrae. We check the feet, the knees, the ankles, the shoulders, even the skull can be adjusted. And we start putting everything back in place, that balance out the muscles. Now, it's amazing. So here's the thing, if you have symptoms, you should get your spine checked. Neck pain, back pain, shoulder pain, headaches. If you don't have symptoms, you should get your spine checked. Because 90% of the time there is no pain. Okay? If you've ever been in a car accident, ever, if the car was damaged, you were damaged 100% of the time. I have people come in 10, 15, 20, 30 years after an accident. I'll take an x-ray and I'll say, you have quite extensive arthritis here. It looks like it's about 30 years old. I was in an accident 30 years ago. I had a sports injury. I got hit in the head with a volleyball. How did you know that? Well, we know how quickly bones degenerate, or discs degenerate, so we can kind of guess within a very wide range how long the injury's been there. And if you have arthritis and you don't put the bones back in place, it gets worse. 100% of the time. So why make it feel worse?